Now, the COVID picture is looking dire, especially in Europe. Now, Austria will become the first country on the continent to reimpose a full lockdown starting on Monday. Chancellor Alexander Schallenberg says the restrictions will last a maximum 20 days to try to tackle the surge in new cases. Mandatory vaccinations will also be introduced from the 1st of February. Our correspondent Sarah Morris reports.
Unvaccinated people in Austria are already in lockdown, but as of Monday, the whole country will be asked to once again stay at home. The shutdown will last for 3 weeks. With restaurants, pubs and all non-essential shops to close, schools will also revert to online learning.
Despite months of persuasion and intensive media campaigns, we've not succeeded in convincing enough people to get vaccinated. We have too many political forces that are vehemently fighting against this, which is irresponsible and an attack on the health system.
The health system is clearly under strain. With one of the highest coronavirus infection rates in Europe, beds in Austrian intensive care units are running short.
We are exhausted. We have been in this situation for a year and a half now, and I have to say it wasn't as bad last year as it is now. It feels like it gets worse with every wave.
With just 66% of Austrians double jabbed, the country has one of the lowest vaccination rates in Western Europe. But from the 1st of February next year, vaccination will be compulsory.
I think we all agree increasing the vaccination rate is the only way to get out of this vicious circle of virus waves and lockdowns. We don't want a 5th wave, and we don't want a 6th or 7th wave either.
In an already vaccine-hesitant country, the decision to make inoculation mandatory will attract controversy.
This is an interference with personal rights. Everybody has the right to decide that on their own. And for me, vaccine obligation is a no-go.
I have been vaccinated 3 times. I think it is right, and we will regret if we don't do that.
Austria's lockdown is designed to finish before Christmas, but some fear it will not work fast enough to save the festive season. And as the 4th wave of the virus sweeps across Europe, many are now wondering if the vaccine alone will be enough to end this pandemic. Sarah Morris, TRT World.
Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School and joins me live now. Dr. Pankhania, why is the virus again sweeping across Europe with such severity?
It's a perfect combination of a multiple number of things. One, the cold weather makes people go indoors. Second, the dropping of the guard with respect to wearing masks. The third bit is that a large proportion of the population remains unimmunized. So when you put all those combinations together, it's a perfect storm for generating new cases and case numbers to go up, and then hospital admissions to go up, and then ITU and people on ventilators. It is a sequence of events.
The WHO blames, as you mentioned, the easing of restrictions and complacency. Have we all become too complacent?
I'm afraid there is quite a lot of what we would call pandemic fatigue. But what is really important is for politicians to give correct, sincere, timely advice. And in here and in the United Kingdom, we find that the politicians are often trying to be popular. And in the process of being popular, they focus on one thing and one thing only: boosters, boosters, and boosters. Whereas to control it properly, what you need to do is multiple layers: boosters, seasonal influenza vaccine, ventilation, wear a mask, wear it properly, wear a good quality mask, avoid crowds. All of those sequence of events are also equally important.
Are you a fan of lockdowns like these that we're seeing in Germany and Austria? Do they work as the kind of circuit breakers that governments are hoping?
It is a sign of failure. It is so disappointing because we don't want lockdowns. And a lockdown, the politicians should own it as a failure of their control measures. It is a result of last attempt, because what they should have been doing is, as soon as they saw that there was a reluctance to take the vaccines, address it. As soon as they saw the case numbers were going up, put the brakes on. So timely, early, extensive actions prevent lockdowns. And then lockdown is a final event, unfortunately.
Okay, and what about making vaccinations mandatory? I mean, it's one thing to ask people to be vaccinated, it's another thing to order them to do it.
Totally agree with you. I find I have been in this business for over 30 years, and I have never forced anyone to take their vaccines. I remember talking to mums about their concerns about the MMR vaccine, and I advised them, I educated them, I told them the pluses and the minuses, and then the mothers made their decisions. I feel we should not go down the territory of forcing people. Again, this is an example of failure. The Prime Minister in Austria was saying, we have been trying for the last 5 months to inform, advise and educate the people, but I have a feeling that there is a conflict over there in Austrian community between pro-vaccine and anti-vaccine. So again, this is a failure of getting the right messages across.
Okay, Dr. Barak Pankhania, always great to hear your thoughts on this. Thanks so much for joining us on the programme.